The mini lift is one of my favorite and most satisfying procedures and is a very good option for many patients looking to tighten and lift the skin of the lower face and neck. Now, the first thing to understand about any kind of facelift procedure is the terminology. Weekend lift, thread lift, lifestyle lift, quick lift, mini lift, lower facelift, full facelift, and many other terms are used to describe procedures that aim to tighten and lift the face. Patients are often understandably confused about how one procedure is different from the next, and whether or not a procedure recommended by a doctor will achieve their specific goals. I essentially perform two types of facelift surgery, with some modifications in some cases that allow me to customize a procedure as much as possible for a patient when indicated. The first facelift procedure is the traditional lower facelift, which lifts and tightens the skin of the lower face and neck under general anesthesia in a surgery center. The second procedure is the mini lift, which has many similarities to the traditional technique. The keys to the mini lift in my hands are these. The procedure is performed under local anesthesia with numbing shots in the office. It is a true muscle lift rather than a skin-only procedure. The SMAS, S-M-A-S muscle in the lower face and platysma muscle in the neck is dissected and lifted, and loose skin is removed without stretching or pulling. There are no drains placed, and a light head wrap is removed at home after 2 days. Recovery is about 1 week, with stitches removed somewhere between day 6 and 8. Complete healing and resolution of swelling is 4 to 6 weeks, and patients tend to remain satisfied with the results for somewhere between 5 and 10 years. There are many factors that go into maintaining and preserving results that will be discussed during the consultation. Now, all of this sounds pretty reasonable to most patients, but what are the downsides and how is this different from a traditional lift in the operating room? The biggest factor for me has to do with the difference between having a patient under local versus general anesthesia. Under local, in the office, there's a limit to how aggressive or thorough I can be with the lift while keeping a patient completely comfortable, particularly if there is significant looseness in the neck as opposed to the lower face. The muscle in the neck can be difficult to numb and challenging to access due to technical factors that are beyond the scope of this video. So if I see a patient whose primary concern by far is significant loose skin and muscle in the neck, I may steer them toward general anesthesia in the OR. In summary, the ability to perform the mini lift under local anesthesia, which decreases cost, risk, and recovery, is a big deal to many of our patients who would never consider this type of surgery under general anesthesia. The best way to determine whether the mini lift is right for you is a face-to-face consultation